focused, and fearless. Here's everything you need to know as you jumpstart your day. I'm Charles Lejano. It is officially day one of the reinstated enhanced community quarantine in Metro Manila, Rizal, Bulacan, Cavite, and Laguna. To tell us how these tighter restrictions are being enforced on the ground, we have Justine Punsalang reporting live to the Susana Heights Toll Plaza in Muntinlupa. Justine, could you tell us what you're seeing over there?
Charles, authorities is once again set up checkpoints all over Metro Manila since midnight, signaling the start of the week-long of enhanced community quarantine in NCR and nearby provinces. In the city of Manila, there are checkpoints at its boundaries with Caloocan along Rizal Avenue, Quezon City near Welcome Rotonda, and at Manila North Cemetery, Navotas along Road 10, and Pasay at Rojas Boulevard at corner Quirino Avenue. In Parañaque, the local PNP has two main checkpoints. One is along Dr. A. Santos Avenue, where it shares a border with Pasay City, and one just right after Sukat Toll Plaza. Meanwhile, in Muntinlupa, the police have set up a checkpoint at Barangay Tunasan, which marks the border of the city and San Pedro, Laguna. The police manning the checkpoints explains that their main purpose is to make sure that APORs or authorized persons outside the presidency and those with essential businesses are the only ones hitting the road. The NCRPO says besides the local checkpoints all over Metro Manila, they have designated 8 quarantine control points. One is in Susana Heights Toll Gate, one is in Alabang Toll Gate, Philinvest Toll Gate, Sukat Toll Plaza, Bikutan Toll Plaza, Skyway Entry, Nichols Toll Gate, and another one in Balon Bato, Balintawak, Quezon City. Meanwhile, over the weekend, the Barangay Bureau of the City of Manila announced that quarantine passes will be once again used in the city. Only one quarantine pass will be issued per family and an odd-even scheme will be implemented. Holders of passes that end in odd numbers will be allowed to leave their homes on Monday, Wednesday, Friday, and Sunday morning, while those with even numbers may leave on Tuesday, Thursday, Saturday, and Sunday afternoon. Charles, right now, we are with the PNP Chief Directorial Staff Police Lieutenant General Hawthorne Binag, and he is actually doing rounds here in Muntinlupa City. Previously, he was at the Susana Heights Toll Plaza, and currently he is here in Barangay Tunasan, which is the border of Muntinlupa City and San Pedro, Laguna. He is expecting that there will be a bit of confusion amongst people since it is the first day of the re-implementation of ECQ in Metro Manila and nearby provinces. Charles?
Thanks for that, Justine. That was Justine Punsalang reporting live from Muntinlupa. The Health Department once again reported over 9,000 new COVID-19 cases on Sunday. That brings the total case tally in the country to more than 721,000, over 105,000 of which are still considered active. 11 people died on Sunday due to the coronavirus disease, pushing the national COVID-19 death toll to 13,170. While 22,000 more patients recovered from the virus, bringing the total recovery count to over 603,154. And the coronavirus pandemic is not just a threat to our physical health. It's also taking a toll on our psychological well-being by exacerbating mental stress. Mobile journalist Pamela Vasquez gives us a front seat to the story.
The Philippines' battle with COVID-19 has been pushed on for more than a year now. And while community quarantines have been the go-to measure to curb infections, it is also seen as a factor aggravating mental health struggles for some.
Hello guys! Andito tayo ngayon sa Mount Caragao, dito sa Barangay Victoria.
While some people write journals, Melinda takes photos and videos for work or just for fun. But behind the contagious smiles are personal battles. In the middle of the pandemic, she left a decade-long career in media to work in the public sector. With all these changes came the anxiety and self-doubt.
I dread every day na kung papasok pa ba ako or not. Feeling ko, everything and everyone is already against me.
As the pandemic sped past its first year, the Health Department reported an increase in calls to the hotlines of the National Center for Mental Health. In the first quarter of the year, there were 3,000 calls to the hotlines, almost 900 of them suicide-related. Non-government organizations like the Natasha Goldburn Foundation also noticed a spike of hotline calls. The foundation was getting 60 to 80 calls a day, averaging 1,800 to 2,200 calls in the last 3 months. Roughly half of the callers are struggling through financial problems brought by the pandemic. But there are also students as young as 10 years old, experiencing stress under the blended learning system. The anxiety and stress has spilled over to the Foundation's social media page.
In our Facebook, we have already threats. I'm going to kill myself.
It doesn't help that there is a stigma associated with those seeking help.
We have to stop gossiping, rumor mongering, trying to figure out what really caused a suicide, what caused a mental depression.
Whether it is through a helpline or a helpful friend, Melinda says what matters is having someone to talk to and someone to listen.
It really helped me na may ibang nagbabalidate dun sa feelings ko.
COVID-19 does not choose who it hits. That goes the same for anxiety and depression. And while we're in the middle of a rising wave of cases, creating more fears and frustrations, it's important to be reminded that there are people and organizations willing to help. I'm Pamela Vasquez and we are One News.
With the government's vaccination program well underway, some of you might already be thinking about your travel plans. However, experts are advising against booking vacations, especially right after getting vaccinated. Bloomberg's travel editor, Nikki Eckstein, explains why.
Vaccines are rolling out slowly but surely around the world. Does that mean it's time to think about traveling yet? According to the most recent data from the World Travel and Tourism Council, published in early November 2020, the restrictions on travel caused by the coronavirus pandemic were projected to take $4.7 trillion out of the global gross domestic product in 2020 alone. Getting back on the road is imperative for economic recovery, but medical professionals still urge caution. Among their warnings, vaccines are not 100% effective. It takes weeks to build up immunity after the second shot. Little is known about the ability to transmit COVID-19 even after immunization, and herd immunity will be a long way off. Their consensus is that risks will remain until the vast majority of people are vaccinated. But freedom of movement can safely increase, allowing for at least certain types of trips among individuals with protection against the virus. That's good news, but yes, you will still need to wear a mask. The COVID-19 vaccines approved to date both in Europe and the US have proven to be exceptionally safe, effective, and the strongest tool yet in combating the pandemic. Still, there are known unknowns, particularly when it comes to possible virus transmission after vaccination. This question boils down to one point. Clinical trials for the currently approved vaccines, including those from Pfizer and Moderna, did not include regular PCR testing of the study participants. Without any data about their ability to carry the virus, there's only enough conclusive evidence to suggest that vaccines are 95% effective at preventing symptomatic infection. Trials currently underway in Israel offer optimism that asymptomatic infection is also curtailed. But the figures are still preliminary and limited only to Pfizer. There are other important unknowns too. That 95% effective number may be remarkably high, but we don't have the ability right now to know who will have a good response to the vaccine and who will be one of the 5%. That's why leading scientists, including US Chief Medical Advisor Anthony Fauci, are waiting to travel until we cross the threshold of herd immunity. By and large, immunologists suggest that it will take between 70 to 80% of the population being immune to eliminate widespread risk, and maybe more. In a best-case scenario where everything goes right, herd immunity could be achieved in the US sometime this summer, with President Biden suggesting that there will be enough supply to vaccinate all American adults by May. But the feat still seems highly unlikely. the evolving definition of safe travel. Expect the definition of safe travel to shift week by week, especially while new variants of the virus continue to emerge. And it's not just about you. Even vaccinated travelers must weigh the consequences of bringing the virus with them wherever they go. Do your homework. Check local case counts and ICU bed availability before committing to any trip in order to ensure that the local system is not already overwhelmed. Also check that your flights and hotels are refundable should conditions change. And plan to spend lots of time outdoors and socially distance wherever you go. Self-contained beach resorts with restaurants on the sand have never looked so good. This is Where To. I'm Nikki Eckstein. For more on this story and more on the future of travel, follow us on QuickTake and Bloomberg. Safe travels!
And that's how the day is shaping up to be. Join us again later at 10 a.m. as we continue to monitor the day's biggest stories from sunrise to sundown. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.